Hi, my name is Anselmo, and today I'm going to talk about depression and anxiety. Depression is the psychiatric and physiological diagnosis that describes a temporary or permanent mood disorder. This is characterized by a total or partial feeling of unhappiness, and, and you can enjoy everything on your life. You feel a little bit lazy and so much things that make you feel like you're not doing good today or you don't have a really good day. And this make that you can enjoy the things that you make every day. The depression could be a less degree or even a higher degree. That depends of every person. The World Health Organization said that depression is a common mental disorder characterized by the presence of sadness, love of disinterest of pleasure, feeling of guilty, lack of self-esteem, sleep or appetite disorders, feelings of fatigue, of lack of concentration. Anxiety can be described like a feeling of restlessness, nervousness, worry or have panic about what is going to happen next or could be happening. Why is this topic important to me? Well, people that I know suffer this mood disorder, and it's a subject that is very close to me, to my friends, to my family. So it's important to me that people starting to know that we need to talk about it. It's not something that has to be like a taboo subject because people usually don't talk about feelings, about how are you doing about your mental health. So it's important to me for that because if we don't knowledge about that, we're not going to start doing anything to stop it, to make feel better the person that we care about it. Usually there are two treatments to this mood disorder. You can go to psychotherapy and talk with professional help, and they are going to to talk to you to search the best way to make you feel better. The first step is know that you have a problem and you have to solve them. So this is the first step, going to search professional help because it's important and depend of how much is the depression, how how degree, how depends of the degree of the depression. You can need some medications, so you can have to take pills to feel better, but it's not in every case. It depends on every person because every person is different, and maybe you only with psychotherapy can can start doing better, but sometimes you need both of them. Testimonials. Well, uh, this is one actress and singer, very knowledge, is Selena Gomez. She suffered depression, anxiety. Part of them is because she is a celebrity and the pressure of the media and all Hollywood fame was under her, over her, and made them feel a little bit anxious and have sometimes depression. Part of that also can come because she suffered a disease called lupus that make her feel feel bad because it's a disease that destroy some parts of the body, and that make her mentally unstable, have this mood disorder. But she searched help, and when she was diagnosed, she was horrified and terrified about it. But at the same time, she was relieved because she she know what is going on with her head, with her mental health, and now she can search for help, and she did that. So she always is very open to talk about it, how how that changed her life, because if she doesn't go to professional help, she maybe she she could pass away because the level of depression that she had. And it's very important to see that everybody is a person that can suffer that, and we need to talk about it, and it's something that she's gonna take later in a little clip that talk about this is really important, and is something that every day have to be more normal, because if we fight against that, we can solve at, at least one person we can help, at least we can do a little thing that change everything.
I'm a huge advocate for mental health. I have this dream of mine that's, beyond all of this, where I think that personally it should be required in schools to be taught dialectical behavior therapy. There is something I read where I think it was the 50s, the 14-year-old kids of today have the same anxiety and depression as a 40-year-old in the 50s. That says so much, and I don't know why that perhaps doesn't shake people up a bit to where maybe there should be more of that accessible. But I am glad that it is being discussed more. I'm glad that we are having the conversation. But it saved my life. Yeah, 1000%. I needed to know. Yeah, and stopping to know that it might have been bigger than something I could control.
Real life implications. Like every mood disorder, these have implications that are going to affect directly to the normal life of this person, and some of them are social interactions because they're going to be less. These people usually get in her own shell. They don't want to talk with her friends, with her family, don't want to go to activities, they only want to stay at home, maybe in the sofa, on the bed, and they don't make any interaction with people. Another thing is there are some professional interactions are going lost because these people is sick, so they have to, sometimes they can go to work, and they go unhappy to the work, so that makes them less productive, that doesn't want to stay there, they only want to go home, or go someone else, some some other place that doesn't have to talk along with people, or because they can feel fear in her own work. And obviously this affects the health itself, because being depressed can make this person to feel bad, to have headache, to have some other mental illness, and may they could uh, have some physical illness because they can suffer another things, or even make him danger by themselves. In conclusion, we can learn about this topic that these people need help. These people sometimes they don't acknowledge that they are going to this problem, uh, we need to approach them, talk to them, and care about them because sometimes we're not aware what is going on to our friends or family or someone you know. You you have to be alert and talk about it, questioning this person about how he's feeling because sometimes we only live our lives normally and we don't put attention to this. And if we see some person that is doing it is being a little different than normally is, maybe we need to talk to that person and ask if there's something going wrong or if they want to share about some subject because if we don't listen to the people that are close enough to us, they never going to know if they have this illness or maybe they need to this little push up to text the next step to search a solution for this.